It's Medical Health File in association with the Islamic Medical Association of South Africa. Tonight we're chatting about free COVID-19 testing for the healthcare workers, public and private sectors. We encourage you to be part of the show on the WhatsApp line 0786 10 11 12, on the telephone line 0216 99 1786. In studio, I'd like to welcome ICPA legal advisor and project leader, Brother Muhammad Botha. Assalamu alaikum, brother. Welcome.
Walaikum salam. Shukran for having me, and good evening to the listeners out there.
Only a pleasure. I don't think Mushfika informed you that when you first come into studio for the first time, you need to bring kusisters, and so that memo you didn't get. Where DHL is working, so we'll expect it later. But Shukran, it's the first time that we've chatted, and thanks for giving up family time, especially to come to speak about a very important topic like this as well. ICPA, what does that stand for?
So ICPA stands for Independent Community Pharmacy Association.
Okay, all right.
To give you a background on ICPA before we jump into the interview. ICPA, alternatively Independent Community Pharmacy Association, represents about 1,200 pharmacies, 3,000 pharmacists, and roughly about 20,000 support healthcare professionals.
Is that nationally?
That's nationally.
Nationally.
So we have ICPA has a large footprint. And it has as its goal and purpose to be the collective voice for independent pharmacies. It's important to note that with independent pharmacies, there's a relationship between independent pharmacies and communities, which is often overlooked, especially if you think about the fact that pharmacies, being on ground level all the time, they actually know exactly what's happening within a community in respect of its health, its general health. And I don't think we always take that into account when decisions around health are being made. And therefore you need a collective voice, and that's why you have ICPA.
Brilliant. We've had the guys in studios a couple of times and explaining the various work that they do over the last years. But you hit the nail on the head. Being part of a community is such an integral role. Auntie Fatima or Uncle Muhammad down the road has been going to that pharmacist for years, and they've got a history, and their kids and grandkids go as well, and it's become a source of almost like a crutch for that family when any illness strikes the family, and can be sorted out quite quickly, rather than going to other pharmacies where you've treated just like another number. With all due respect, they do some great work as well, but it can be perceived as at times.
Yeah, not taking away from other healthcare facilities and other healthcare organizations. I think, especially in today's time, when rands and cents are to be counted all the time, the first port of call for any person who falls ill is the pharmacy.
Yes, absolutely.
Yeah. And I can't overemphasize the value of pharmacy within the healthcare profession.
Okay, so great news. Free COVID-19 testing for healthcare workers, public and private sectors, via your organization. Give us some history around that. How did that come about, first of all?
Okay. Well, obviously we've been through some testing and trying times. I don't think many people have nobody's ventured through these times. It's a first for everyone.
True.
And what happened was that the national, or rather the provincial healthcare Department of Health, Western Cape, approached ICPA and asked ICPA to assist them with testing of healthcare workers.
Okay.
So the healthcare system, as can be imagined, was extremely strained. Healthcare workers needed to be on the front line 24/7. And you simply could not afford to have a healthcare worker at home waiting for a COVID result.
True.
Which at that time could take between 6 and 7 days. And ICPA then took upon this request. The board of directors discussed it. And it was then decided that on principle it was a very good idea. But why limit it to the Western Cape? Why not open it nationally? And once that decision was taken to open it nationally, the Solidarity Fund was then approached.
I see.
And there were numerous proposals drafted in the office, late nights by ICPA's COO and CEO, Ahmed Bayat and Jackie Mayman, drafting proposal after proposal until we finally got it right, submitted the proposal to Solidarity Fund, and Solidarity Fund came back.
Brilliant.
Quite frankly, it's public funds, but Solidarity Fund made available for this project roughly 27 million rand.
Alhamdulillah.
in order that ICPA, through its partners, members, and service providers, may test roughly 36,000 healthcare workers.
Alhamdulillah. As you said, it's uncharted waters. Nobody realized exactly what was needed, what is still needed, and what we currently need. It's an ongoing learning curve that one is faced with. If you are in the healthcare environment, be part of the show. Let us know some of the challenges and what do you think about this amazing initiative that ICPA have now gone into to provide for our healthcare workers. Let us know your thoughts, and maybe you can pose any questions you like to Brother Muhammad in studio as well. Is this an ICPA project, or have you partnered with other organizations?
Okay, so it's definitely an ICPA initiative.
Okay.
Right? And ICPA is the hub for the project.
Okay.
All the administration, all the thoughts, all the planning, the day-to-day running goes through our ICPA hub office. But with a project of this nature, you've also got to realize what you know and what you don't know.
Okay, I get you.
And you've got to ask the community out there who's able to assist. And that's exactly what ICPA did. We partnered up with as many service providers, with as many partners as we could to make the venture a successful one. So yes, we do have partners. For example, I'll list them for you, but our main partner, or one of our main partners, is a company called Vula, V-U-L-A.
Okay.
And they have a mobile app through which you may refer patients for different specialities.
Okay.
So if you needed a doctor who does cardiology, you could actually refer the patient through this app. And they've come on board and they've given us the service in order for ICPA and its partners to refer healthcare workers for COVID testing through this app. And it's made our life extremely comfortable, or rather more comfortable.
Got it.
Right?
Yeah.
And that's just one of the partners.
Okay.
We've also partnered up with Hamadi Labs. They're based in Claremont. And then a secondary lab called Newberg Global, and they're in KwaZulu-Natal.
Okay.
And they're responsible for all our lab work. So once a test takes place at a testing site, that test is then collected by Hamadi or Newberg. It's run through the lab process and the results are then returned.
And I would imagine that these companies are national companies.
These are national companies.
National footprints.
If you look at, between Hamadi and Newberg Global, they are currently servicing 55 of our testing sites.
Okay.
They're also acting as testing sites themselves because they have bleeding sites across the country. So these are national. It's a national project. Thankfully, it's not an international project.
Right.
But it's a national project. And if you've got 27 million rand on hand, or rather available to you, you also need somebody who can administer those funds to you. Because it would be irresponsible of us. It would not be good corporate governance if we were sitting with this money and making payments of one invoice at a time. We then approached Medicredit, and then administrator, a fund administrator. In other words, they act as if they're the administrator for a medical aid, ICPA being the medical aid. And it also allows us then to validate claims or verify claims, because claims will then be passed through them. We'll vet it on our side, and then obviously we'll then make payment to them. And then we've also partnered up, or our main partners are IPAF, MWASA, and BPIA.
Okay.
These are doctors' organizations. So they've made themselves available, or their doctors available to the project. We've also partnered up with Clickertal. And Clickertal provides us with 40,000 SMSs, free SMSs, so that we may SMS the necessary healthcare worker with information. So that information would be a voucher number and an address, informing them where the testing site is situated, so that they would then know where to go to. And our last partner is MedInformer. So MedInformer gives us a platform whereby we may share information relating to COVID. So once a healthcare worker has attended at the testing site and the test result comes back either negative or positive, they may access MedInformer, or we'll access MedInformer for them. And MedInformer, as a platform, will advise them what protocols to follow prior to receiving a test and then after receiving a test. So you start off with Vula being the main partner, because that opens the cycle, and then MedInforma closes the process.
Brilliant. I think you guys have put in a lot of work to consider the various opportunities, how people could access. Now, I know it's only open to medical staff at the moment, healthcare workers. Have you considered other industries that may be exposed to COVID-19?
Yeah, look,
more exposed.
We've obviously thought about the process. However, we are bound by the proposal we made to Solidarity Fund and the contract concluded with Solidarity Fund. So this is a project that's meant to run until December, and then thereafter the project will be revised and extended. The problem with COVID, or rather not the problem, the challenge with COVID is that any plan that you have must be flexible, because the COVID landscape changes daily.
True.
So depending on the need, we'll obviously have a look at the project and see where the project should go, which route the project should take. But yeah, the project currently, I think, is a successful one. And it's because of our partners, and it's because of the sense of Ubuntu that permeates through the project. Everybody wants to help.
Right.
And I think that's the beauty or the positive about COVID, if there is a positive to be found, is that everybody's willing to do their part for community.
So if you're looking at the project, it started how long ago?
So planning phase of this project was about 2 months.
Okay.
2 months of full planning. If you just know what we went through, simply planning. I mean, we had meetings at 7 o'clock in the morning, and everything was via Zoom. Luckily, when you have a meeting at 7 o'clock in the morning, you could be professional on the top.
Got it, yeah. You have your PJs
at the bottom.
Got it, yeah.
But yeah, this was months and months of planning. Planning on a daily basis. I mean, you needed to get service providers. In other words, you needed to get 55 testing sites or testing sites. And you needed to draft and make sure that you have standard operating procedures for the program. You needed to have training on the program. You needed to do webinar training, you needed to do video training, you needed to have information guidelines. So it took a lot of work on the part of ICPA. I mean, the staff at ICPA, amazing guys. In actual fact, I'm going to name drop,
Sure.
So Denise, Tracy, Grace, Vuyo, Shanaz, Arma, Jackie, and myself. We utilize that boardroom on a regular basis trying to work out this project. And I think that's one of the reasons why the project is successful. Because at all times our aim was to try and break the project. And if it can't be broken, then it's working.
Wonderful. I like that aspect, finding the loopholes within, working through it yourself so that invariably, should something not work out according to your plan, you can fix it as well. It's a good system.
What was important to us was that we were dealing with public funds. So this is not a project run by ICPA for the purpose of profit. But if you're dealing with public funds, what's most important is good governance. So we'd rather have the project run according to plan, openly and transparently, and rather than rush into a project trying to get things off the ground as quickly as possible.
Of course.
And then find out later that you don't have the necessary systems in place, and in actual fact you're wasting public funds.
Yeah. I'm chatting to Brother Mohammed Botha, who's part of ICPA legal advisor and project leader. We're talking about free COVID-19 testing for healthcare workers, public and private sectors. So if you'd like to be part of the show on the WhatsApp line, 0786 10 11 12. If you'd like to call in, 021 699 1786. I would imagine that, a project like this has various has various entities with regards to the governance, like you said, of this project as well, and late nights, early mornings, things like that. COVID itself has been changing across the world. Are you in contact with other parts of the world to know where we are in South Africa, or are we do we have the same symptoms as the rest of the world?
Look, obviously across the globe, COVID is being dealt with differently by different countries, and different countries are being exposed to COVID in a different manner. We're constantly learning, and yes, we are in contact. There's no way that you could run a project of this nature without taking the necessary expert advice. So if you were looking at COVID 2 months ago, I mean, people were being exposed to COVID daily, and the numbers were increasing exponentially. And it seems that we've passed the peak. However, lockdown regulations are easing, but that does not mean that people like ICPA and individuals should not regulate for themselves. We should be acting as if those lockdown regulations are still in place. The virus is not gone. There's not a vaccine. And an indication of that would be the fact that someone like the Solidarity Fund is willing to sponsor or to fund this project, because there remains a need for COVID testing. I mean, across the world, globally.
So the project started 4 weeks ago. I would imagine lots of people, healthcare workers, took up this opportunity to come. And so how do you actually allow these healthcare workers to be tested? Is it almost that tick box system where they need to identify if they were exposed to certain symptoms? How does it work?
Okay, so the best way to explain, I suppose, would be by example. But let's just clarify that it's healthcare workers, clinical and non-clinical.
Okay.
So these are your nurses, your porters, your delivery guys, your administrative office. But they've got to be essential service. Okay, so it could be your occupational therapist. It could be your community health worker. We've not limited to a specific sphere of doctors only, or surgeons, or healthcare professionals high up on the food chain, for the lack of a better term. And those healthcare workers must have symptoms, and also they must not have medical aid. Alternatively, the medical aid must be exhausted.
Okay, got it.
So this is really a project for healthcare workers within the community. I mean, there are healthcare workers who need to be tested, and they don't have medical aid, but that test costs 805 Rand or 850 Rand, whatever that amount might be. And they'll have to test themselves this week, and they might have to do it next week again, because the exposure is constant to COVID patients. So that's why the project is there. But it's only for healthcare workers who have symptoms, and together with that, they should not have medical aid, or their medical aid benefit should be exhausted.
Okay.
How they would go about actually accessing the project would be, if, for example, we would say Grooteskier Hospital for one. There would be a nurse or a porter at Grooteskier Hospital, and he would wake up one morning and say, look, I think I might have COVID. I've got a cough and a sore throat and whatever the case may be. So instead of that healthcare worker panicking about this, look, I might be out of work for 7 days if I have myself tested. He could go to his office, call his line manager, whatever the case would be, and say, look, I need a COVID test. A doctor at that facility, or a pharmacist, wherever that person might be employed, will refer that patient through the Vula app.
Okay.
Once that referral is made through the Vula app, the ICPA hub gets a notification that there's a referral. Immediately we would SMS that patient, and that patient would be SMS'd a voucher number.
Okay.
So that voucher number is your currency. So remember, we're sitting with some cash in the bank account, which we've then converted into a voucher number. Together with that voucher number, they'll receive the SMS to say, please attend at this pharmacy or at this testing site, and please contact the pharmacist before you attend, or the doctor, in order to make an appointment.
Okay.
They'll then attend, present the voucher number, be tested. The testing site goes back onto Vula, advises via the Vula app that the test has been completed. Again, the ICPA hub will get this information, will inform the labs to collect the test. The lab will do so, and the lab will then run the testing. Once the labs collected the test, they'll inform the ICPA hub again that the test has been collected. And the results should be available within 24 hours.
That's amazing.
So our timeline, or our obligation to Solidarity Fund, is that we must provide the result within 48 hours. But currently we're running on a 24-hour turnaround, which means, like I said, someone can go in this morning, be tested, possibly have the results by this evening and be back at work tomorrow.
How's the project working since you've started? I mean, is the system working okay? Were there a couple of challenges?
There's always challenges, but we set ourselves up. The project is now in its 4th week. The first 3 weeks was really just to try and break it.
Okay.
But we've run the project. We haven't told anyone that it's a testing phase. We ran the project.
Almost like a soft launch.
Yeah, soft launch. Alhamdulillah, it's been quite successful.
Alhamdulillah.
I mean, obviously, it's difficult to say that there have been positives, because any positive out of the project is a negative for someone else.
I get what you're saying, yeah.
So what happened was, for example, last week we tested some healthcare workers who tested positive for COVID.
Okay.
But as a result of that positive testing, a healthcare facility needed to close down. But the positive spin out of that is, because you have this type of project, that facility then closes down, but then it also limits exposure of COVID to the patients and clients that would have attended that facility. And therefore it's important to have this quick turnaround time, so that whether it be a doctor's surgery, a nurse's a nursing school, a pharmacy, with this quick turnaround time, we know that there's COVID in a certain area or in a certain facility, and we can take the necessary steps to either close the facility or to do decontamination, fogging, and so on and so forth. But it limits the exposure then to the community at large.
In your testing centres at the moment and your facilities, which province seems to be utilising your services more?
At this point in time, it's KwaZulu-Natal.
Okay.
KwaZulu-Natal seems to be utilising the project more. I'm not able to stick my neck out and say, well, it's because COVID is more prevalent in KwaZulu-Natal. There are various factors. It could be that KwaZulu-Natal testing sites are just more active and more energetic about it. And that's why we're on the radio today.
Absolutely.
To tell others to get on board so that we can get more energy into the project. And you might find that testing increases in one region over the other. But it's COVID. It's difficult to say.
Absolutely. We're chatting to Brother Muhammad Botha, who's an ICPA legal advisor and project leader for the free COVID-19 testing for healthcare workers. And that's public and private sectors as well. We're going to take an ad break. When we come back, we chat a bit more to Brother Muhammad, and we encourage your input on the WhatsApp line 0786 10 11 12, on the telephone line 021 699 1786. Very important and pertinent topic tonight. And if you are in the healthcare services, let us know your thoughts around this topic tonight. A couple of WhatsApps coming through, and I think these are pertinent to some of the, you've already spoken to, about some of this, but maybe we can reiterate for our listeners. The first one reads, Assalamu alaikum. Does the free testing also apply to reception and admin staff in the healthcare facilities?
Okay. So let me respond to that properly by saying wa alaikum salam wa rahmatullahi wa barakatuh, and then inform that listener that it is the testing of any healthcare worker, clinical or non-clinical, as long as they are in essential services. So yes, it would include a receptionist, admin staff, cleaner, porter, messenger. As long as they're on the front line, we consider them to be healthcare workers who are in need of testing. However, they must have symptoms.
Okay.
And also they must have a medical aid that's either been exhausted or no medical aid at all.
Okay.
But if there's any confusion or any person out there who wishes to have something clarified, do I qualify, don't I qualify, they should just simply give ICPA a call or email us. And the email address there would be covid@icpa.co.za. Alternatively, they can contact us on 021 671 4473.
Okay.
They could speak to anyone at the office. Whoever picks up the telephone is well versed on COVID, and they'll be more than willing to help.
Okay, we're going to give it some of those details a bit later as well. Another one come through on the WhatsApp line. Speaking about medical aid, Salam, will you still do the test for healthcare workers if she had one? She had one on her medical aid already. They only pay for one test. Shukran. So it looks like medical aids have limited.
Yeah, so certain medical aids cover the PMB for one test only. I'm even told that some medical aids won't cover it as a PMB, but that's for a different discussion. My colleague Ahmad Bayat would like to get involved in that conversation, but be that as it may. Yeah, salam, and to inform that person, yes, they may be tested.
Okay.
Exactly. If you have a medical aid and your COVID benefit is exhausted, you may be tested.
Okay.
Under the project.
Alhamdulillah. Chatting about the project as well, if we could maybe just go over some of the procedures with regards to accessing the project one more time for those listeners that may have just tuned in, or we can just reiterate, because this is something new and we would like everyone to benefit from this.
So again, at any given time, if you're a healthcare worker and you are suffering symptoms, and alternatively you've been in direct contact with somebody who's tested positive for COVID, you may access this project. The idea is that you inform your employer, because you are a healthcare worker, your employer would in all likelihood be a doctor or a pharmacist.
Okay.
And that doctor or pharmacist will have access to the Vula app. That doctor or pharmacist will then make a referral via the Vula app and will receive a notification. When I say we, ICPA will then receive a real-time notification. And I can guarantee, as I'm sitting here, within 5 to 10 minutes thereafter, ICPA will contact you if you qualify.
Okay.
In other words, you've got symptoms and you don't have the medical aid, or the medical aid has been exhausted, you will be contacted via SMS. You will be provided with a voucher number, which is your currency, and you'll also be provided with an address for a testing site. And you may attend that testing site to be tested.
Brilliant.
And that test is then funded via the Solidarity Fund.
Got it. Perfect. And we're going to give out some more details later on the ICPA details as well. Now, we do know that most COVID tests are administered, have a cost to it as well. This procedure, this format of how the healthcare workers need to go about doing it, is there a cost to having a test administrated?
So the charge for any healthcare worker using the test is R0 and 0 cents.
Okay.
And if you ask me for a discount, it'll be R0 and 0 cents thereafter. Discount included. The entire project is funded by the Solidarity Fund.
Okay.
And we're very grateful for their funding. And there's absolutely no cost to a healthcare worker who has qualified for the test. The qualification is quite simple. I'm going to mention it again. You have symptoms, you don't have medical aid, alternatively, your medical aid has been exhausted. The project is there for healthcare workers so that they can be tested and get themselves back to work as soon as possible. And when we speak about healthcare workers, it's clinical and non-clinical. And we understand that in today's times, in actual fact, it would be unfair for anyone, whether it be ICPA or any other facility, I think, to charge a healthcare worker to be tested for COVID.
That's a good point.
When, in effect, that healthcare worker is providing a service to the community during very testing times.
And a lot of the healthcare workers, let's face it, during lockdown were the guys that were waking up at 4 a.m. and getting themselves to work and risking them, putting their lives at risk, going home to their families, not knowing whether, families are safe. And yes, it has been rather stressful over the last year. And it's rightfully said, they deserve this type of facility.
Exactly. There's no reason why healthcare workers should be concerned about, can I afford to take a test?
What's been some of the comments and talk around the organization and the facility that you provide?
Look, I think the talk out there has only been positive.
Alhamdulillah.
Not only from those utilizing the project, but from those who are supporting the project, whether it be via marketing or providing us with a service, or simply partnering up, or simply just sending a word of advice or some sort of motivation. It's probably, respectfully in my view, one of the best COVID initiatives out there. Because it goes to the heart of our defense. Our defense against COVID is
our frontline workers.
The healthcare workers. So respectfully, I think ICPA has taken up a massive torch, and I think it's probably the best torch to be carrying at this point in time.
Alhamdulillah. Absolutely. Listeners on the WhatsApp line, let us know your thoughts, 0786 10 11 12, or if you'd like to call in on the telephone line, 0216991786. We're chatting to Mohammed Botha, who is an ICPA legal advisor and project leader on the free COVID-19 testing for healthcare workers, public and private sectors as well. Brother Mohammed, how many healthcare workers do you anticipate being tested over? It's been 4 weeks now. The project's on the go. Taking into consideration how it's been running, what would you think the next couple of weeks is going to look like?
Our initial estimate was about 36,000 healthcare workers over a 3-month period.
Okay.
But obviously, at that point in time when that estimation was made, COVID was at its peak. COVID was at its angriest. So now things have slowed down slightly, and we need to relook those numbers. We don't think we're going to get close to the 36,000.
Okay.
Especially because our project is also it has that condition that it has to be a healthcare worker with symptoms.
Okay. Yeah.
But yeah, we well on our way, and I foresee us doing about maybe 1,000 tests per week.
Okay.
But again, I'm not willing to guarantee anything at this point in time, because COVID is a funny thing. The second wave might hit sooner than we think, or it might not hit at all, and the numbers could turn.
Yeah, it's it's uncharted waters. When COVID first hit, I chatted to the guys that were working directly at the hospitals that were doing the testing, and these doctors were run off their feet. I mean, they were just working hours that are beyond their capabilities, and the staff as well. So they've put themselves at risk. And one of my questions to the staff at the core of the epidemic was, are we okay? Are we getting enough information? Are we are symptoms changing? And the answer was daily. It was at that time. It was changing daily. Some of the responses that were coming through from the rest of the world. So South Africa was trying to gather as much as all. And with a project like this, I would imagine the same type of concerns, same types of talks go on in the corridors.
Yeah. So what we've done is we've spent months trying to work on a logistics plan and trying to work on a service-orientated plan, and we've put certain operational procedures in place, and ICPA has crossed its I's and dotted its T's. But the beauty of the planning, or rather the thought process, was that the project is extremely flexible. So the arms of the project are allowed to move in different directions depending on what the body requires. So as COVID changes, as we find out there are new symptoms, or that certain symptoms are no longer considered to be COVID symptoms, we can modify the project and the referral system based on the information we receive.
I see. Okay. So at the moment, it's physical testing stations. Is there a need for a mobile unit, perhaps?
Well, that's exactly what we've got. So we've got a mix and match.
Okay.
We've got 55 permanent testing stations.
Okay.
And that's across the country. And in certain places where we don't have permanent testing stations, we would then use the services of our laboratories.
Okay.
And we'll ask them to go out and do mobile testing if necessary, and we'd use their bleeding sites.
Okay.
Look, the idea is not simply to be testing people in urban areas and metropoles. The idea is to get this out to rural areas as far as possible.
Reach all corners of South Africa.
Healthcare workers and community healthcare workers don't simply live in your built-up suburbs. There are healthcare workers that come from far-reaching places to provide services to the urban and metropoles.
The private sector, do you find, that's been utilized, people coming through and taking these tests?
The private sector has definitely come on board.
Okay.
The private sector is definitely making use of the test. Again, we were looking to decant from the public sector's testing, from public sector into our system.
Right.
But at the same time, we're looking to alleviate all facilities. In other words, they should have capacity to be dealing with the community out there, with community patients who are coming in and saying, look, I need a COVID test. Can you assist me? So rather decant all of those testing of their own employees and their own healthcare workers into our project, and therefore freeing them up to deal with the community.
Last couple of minutes left on Medical Health File in association with the Islamic Medical Association of South Africa. Chatting to Mohammed Botha, ICPA legal advisor and project leader of the free COVID-19 testing for healthcare workers, public and private sectors. Do join us on the WhatsApp line 0786 10 11 12 if you have any concerns, questions, or if you'd like to find out a bit more how this all works and how this all came together. But definitely hats off to ICPA for doing this initiative, and I'm sure lots of people are benefiting from this as well. And it's more the emotional state more than the physical part of COVID-19, because there's so much stress that these workers go through, thinking that they could be exposed to COVID-19 more than actually the physical side.
Yeah, look, I mean, you could ask probably any person in this studio now, do you think you've had COVID? And they'll tell you yes. If they cough at home, or if they sneeze, or all of a sudden they've got a sore throat, they think, I must have had COVID previously. Correct. I have so many friends that probably thought they've had COVID before. And these are people who are not exposed to
they're not frontline
COVID.
Workers.
Exactly.
Yeah.
So the healthcare workers are exposed on a daily basis, and this project is for them so that they can have some sort of peace of mind. I'm having myself tested. I don't have COVID. I can go home and spend some time with my family. When you get the morning, you go in the morning, you go to work. You happen to have direct contact with a COVID patient. You have yourself tested. And hopefully by the end of business, your test results will come back as negative, and you can go home to your family without being worried that I've possibly contracted COVID.
One come through on the WhatsApp line. If you can, maybe assist to answer, I'd appreciate it. If not, it's not a problem. It says, Assalamu alaikum. How long does one have immunity against COVID? Any concrete evidence?
It's a difficult one. My expertise are legal in nature, but I have read a couple of documents on COVID. I don't think there is an immunity to COVID at this point in time. You might be tested today and find that you're not COVID positive. That's not to say in 2 or 3 days from now, when you tested, things could have changed.
Right.
I'm not sure. I can't really give a medical opinion on whether or not your body creates antibodies after you've already tested positive for COVID. So,
the weird thing is that, I was out and about today, and I was in the Claremont area, and people are walking around without masks openly. Like, do I go up to that person and say, where's your mask? Or do I leave them be?
And we're going to find ourselves in a Donald Trump situation.
Yeah, that type of thing. Another one.
I'm going to reiterate the point I made earlier. The fact that lockdown levels have come down, that's for other reasons. I mean, that's for the opening of the economy and so on and so forth. But we've got to self-regulate.
Absolutely.
We don't need government to regulate our own health. And we should be social distancing, cleaning our hands, making sure we're wearing our masks. I'm not saying live in fear.
Sure.
But
take precautions.
Be sensible.
Yeah.
Be sensible.
So elaboration on who or what is ICPA. Can our guest please elaborate on who the ICPA is?
So, as said earlier, ICPA is known as the Independent Community Pharmacy Association. So it's an association that has as its membership 1,200 pharmacists, roughly, pharmacies, 3,000 pharmacists, and plus minus 20,000 healthcare professionals as members. And the idea is that ICPA acts as a collective, or a voice on behalf of the collective, on behalf of all independent community pharmacies.
Okay.
In other words, your VitaCare in Lansdowne, ICPA speaks on their behalf. So we have a collective voice, and any interest of independent community pharmacies who see patients on a day-to-day basis. The same patient over and over, the same diabetic patient, the same patient who comes in for chronic medication. ICPA membership speaks to those patients on a day-to-day basis And it's ICPA's job to make sure that that relationship remains protected and that independent pharmacy remains protected.
Okay. WhatsApp come through. I have to read this one, and so I apologize in advance. It says, Salam Lukman. Please tell Muhammad his siblings say salam, and we're very proud of him. He has a voice for radio. So that's from your sister.
I'd like to say shukran to that. I don't think I should take it as an insult. Because normally you tell someone they have a voice for radio when they don't have a face for TV.
Correct, yeah. So Jazakallah so much, Mushfika, for that. She normally comes on a Wednesday to entertain us. Yeah. So once again, Muhammad, hats off to you and your association for coming up with what seems to be an amazing initiative and respectfully helping our frontline workers, our essential workers who definitely need this type of facility every single day. In closing, is there any final message you would like to convey to the healthcare workers listening?
Yeah, well, to the healthcare workers out there, firstly, thank you. I think that they need to be told on a regular basis that they appreciate it. Not only told, but I think the community out there should show their appreciation, whether it be through a smile or a glass of water, whatever the case may be.
Not just the Jerusalem dance.
Exactly.
I got it.
These healthcare workers, and when you think of healthcare workers, you should accept that there are healthcare workers who have to wake up early in the morning, take public transport, so that they can be there at our beck and call. And it can be a very frustrating activity to take part in on a daily basis. So I want them to know that they definitely appreciate it, and I want them to know that they are the true heroes of this pandemic, despite any regulation or any other party out there making decisions. Those that have to implement those decisions, like the healthcare workers, they are indeed the true heroes, and I want them to know that that's the case. I mean, also at the same time, I'm going to take the opportunity to thank Radio 786 for affording ICPA this opportunity. May there be many more interviews of this kind with ICPA, hopefully.
Inshallah.
And then I've got to thank our partners. I've mentioned them earlier. They've shown us the spirit of Ubuntu, and we appreciate everything they've done. And then the office, the ICPA hub. Without them, this project was not possible. Those are really guys that you'd go to war with.
Brilliant. ICPA legal advisor and project leader Muhammad Botha, it's been an absolute pleasure. Have a wonderful evening. Assalamu alaikum wa rahmatullahi wa barakatuh.